Good afternoon, my name is Daryl Taylor, the Youth Football Director for your Cleveland Browns, and I'm joined here today by the best mascot in professional sports, Chomps. And we'd like to welcome you to the 2020 Virtual Youth Football Clinic in association with University Hospitals. Today, we have various skills, drills, and challenges for you. Parents, we ask that you post your children's challenges on social media using hashtag BROWNSCLINIC so that we can see the progress and that we can track along the way. Without further ado, I'd like to turn it over to our coaches today. We have Coach Mark Maruna, who's the offensive coordinator at Brunswick High School, and we have Coach Damian Creel, who is the head coach at Beechwood High School. Let's go, Coach.
Okay, campers, our first drill of the day is a back pedal and break drill. During this drill, our objective is to teach a proper defensive back stance and at the same time learn how to execute a proper back pedal technique. All right, we're back to back pedal and break drill. We have 5 campers here to demonstrate the technique. When I say go, what I'm going to ask these campers to do is get in a great stance with their knees bent, shoulders over their knees, and they're going to back pedal with running arms. And when I say break, they're going to break and come back up. Let's see how our campers do. Ready, go. Break. Good job. Ready, go. Break. Good job. Next up, ready, go. Good. Shoulders over the knees, break. Nicely done. Okay, campers, the next segment of our back pedal drill is called a 30-second challenge. In this drill, campers will be asked to back pedal to the middle cone where they'll break, run forward and touch the front cone. Each of those touches counts as 1. You'll immediately return to the middle cone, back pedal break, and touch here as 2. This is a 30-second challenge, so do this as many times as you can and see what your best score is. Let's see how this camper does on her first attempt. Ready, go. Back pedal, come up and touch. Back pedal, come up and touch as fast as you can. That's good. Our final segment of the back pedal drill is our advanced variation. In this variation, the difference is that you'll receive a pass after you break. Okay, let's see how we do in a 30-second challenge. Ready, go. Break. 1. 2, nicely done. Okay, campers, drill 2 is a blocking shuffle drill. In this drill, our goal is to execute a proper stance and to learn how to shuffle to stay in front of the individual we're blocking. Okay, during the blocking shuffle drill, your goal is to have a nice wide base, your knees bent, and your chest out. Can you show me that stance, please? Good, and in this drill, you're gonna shuffle until you get to the first cone and shuffle right back. Ready, go. Great job, shuffle back, good. Next up, nice wide base. Ready, go, bend your knees. Great job, chest up. Excellent. Ready, go, chest up, knees bent, great job. Okay, campers, phase 2 of our blocking shuffle drill is our 30-second challenge. In this drill, you'll shuffle to the far cone, that counts as 1, and when you shuffle back, that counts as 1. Your goal is to see how many times you can shuffle in that 5-yard zone in 30 seconds. Ready, go. Good job. 1, 2, 3, 4. Excellent job, Miles. Okay, campers, the third phase of our blocking shuffle drill is our advanced variation. In this drill, we're gonna ask Nate to shuffle, and when coach says hit, okay, he's gonna punch the basketball and it'll return to coach, and he's still gonna get to the opposite side and touch that cone. And we're still counting for the most reps we can get in 30 seconds. Are you ready? Nice and low, good stance. Ready, go. Great job, come back. Keep going, keep going, keep going. Excellent job. Okay, campers, drill 3 is our fast feet receiver drill. During this drill, you're gonna work on proper stance, having outstanding balance, and working on fast feet. All right, campers, in the quick feet receiver drill, the first thing you need to do is set out 2 cones and imagine a line between them. What you're gonna do is get in a nice stance with your knees bent, arms at your sides, and you're gonna step 2 feet in front of the line and 2 feet behind the line until you make it all the way to the other side. Ready, go. Great job, eyes up, run the arms. Excellent, ready, go. There we go, fast feet, fast feet, fast feet, fast feet. Excellent, go. Good job. As quick as you can go, as quick as you can go. Okay, campers, phase 2 of our quick feet receiver drill is the 30-second challenge. Our 30-second challenge is to do our fast foot drill and catch a pass at each cone. Every time you catch a pass, it counts as 1 and you're going for your best score. Ready, go. Quick feet, quick feet, quick feet. Catch a pass. Give it back. Quick feet, quick feet, quick feet, quick feet, quick feet. Great job. Okay, campers, phase 3 of our quick feet receiver drill is our advanced variation. In the advanced variation, our camper will actually face away from coach, still do the fast footwork drill. When he hears the call turn, he will turn and catch a pass, and we'll do that at each cone. Every pass you catch counts as 1. Go for your best score in 30 seconds. Are you ready? Turn away from coach, please. When I say go, you're gonna go fast feet and listen for the turn call. Ready, go. Fast feet, fast feet, fast feet. Great job, give it back. Turn around, go.
Turn.
Awesome job. Okay, campers, drill 4 is a punt return clap drill. In this drill, our goal is to learn proper punt return technique. Our goal is to receive a punt in a basket with our pinkies together, looking it into the basket. We're gonna let our campers demonstrate here. Ready, go. Look it in. Great job. Bring it up. Good. Ready, go. Look it in. Great job. Bring the ball in. Ready, go. Look it in, make a basket. Great job. Pinkies together every time. All right, campers, our final phase of the punt return clap drill is our challenge of the day. In the punt return clap drill, your goal is to throw the ball up in the air to yourself, clap once, and catch the punt with correct punt return technique. After you've achieved 1 clap, you want to move on to 2 and 3 and 4 and so forth and see how high you can go. Caroline, you're going to demonstrate 1 clap. Ready, go. Excellent job. 2 claps. 3 claps. Excellent job. And Caroline would try to go as high as she can and get her highest total.
Hi everyone, I'm Dr. Sean Cupp. I am a sports medicine specialist and co-director of the Sports Medicine Institute at the University Hospitals here in Cleveland. And I'm the lead medical physician for the Cleveland Browns. I wanted to talk to you today about some medical sports medicine issues. The first thing I do want to talk about is the coronavirus and COVID and some recommendations in regards to that. As your children are out playing football, one of the important things that they need to have is their own water bottle. There won't be sharing of any water bottle or any water devices as they're out at football practice. The most important thing to do is check your child's temperature before they leave the home. If the temperature is 100 degrees or higher, they need to stay home and probably check in with your medical provider, your family doctor or pediatrician. Encourage to wash their hands frequently, covering their coughs by coughing into the elbow, and avoid touching a lot of surfaces when you're out in public. But the most important thing is if they're sick, they need to stay home, and that'll help mitigate the spread to other athletes. Now we're going to talk about heat and hydration. And I want to talk about the differences between heat cramps, heat syncope, heat exhaustion, and heat stroke. A big factor is the humidity in addition to the outside temperature. Heat cramps is something that are very common. They're involuntary, painful muscle contractions. They usually happen during or immediately after prolonged exercise. So a good way to treat those is by replacing the salt with a sports drink. Some of the symptoms that you look for with cramps are pinpoint location of muscle pain. The muscle can lock up. Another heat illness that we deal with is heat syncope. This is when the athlete gets an elevated temperature, starts to feel weak, may feel dizzy or lightheaded. They can have tunnel vision, and their skin is usually pale and sweaty. You definitely want to take them out of the activity, put them in shade, cool them down with water, even with immersion in a water tank. As heat syncope gets worse, it falls into a category we call heat exhaustion, and this is whenever the body's ability to maintain the normal body temperature goes awry, and there is a strain on the system, and they can no longer get rid of the heat that the body produces, and therefore the body's temperature will elevate to unsafe levels. And some of the symptoms that you may want to look for is nausea, vomiting, chills, hyperventilation, which is breathing too fast, fatigue, weakness, paleness, headache, severe muscle contractions. The one we really worry about is a heat stroke, and this is when the body completely loses its ability to get rid of heat. Core body temperature raises above 105, and the heart starts to beat really fast. They start to breathe really quickly. The blood pressure drops. All of this can produce what we call syncope, or lightheadedness and loss of consciousness. Body's unable to cool itself with its normal sweating mechanisms. Some of the other symptoms that we look for are changes in the central nervous system, confusion, irritability, headache, dizziness, fatigue, anxiety. Sometimes they can even pass out and have unconsciousness or go into seizures. Again, the treatment for any of these heat illnesses is to stop the activity, immediately cool the body, get them in a shaded environment, replace the fluids with water as quickly as you can. And if they do have loss of consciousness or confusion, definitely seek medical care. That may be calling 911 and getting them to the hospital for further treatment. And now let's talk about concussion. Now, concussion is something that is a potential risk factor when playing the sport of football. It happens in a lot of sports. It's not isolated to just football. Girls soccer, both boys and girls hockey, now are having rates as high as football. We do have a lot of concussion injuries in the sport of football, but we also have twice as many people playing football than any other sport in our country. Now, as the activity levels are going up in newer sports like lacrosse and boys and girls soccer, and we're able to get that data, we're actually seeing that the incidence is actually pretty similar in those other sports as it is football. So the signs and symptoms that we want to look for when someone has a concussion is the physical symptoms of headache, nausea, vomiting, dizziness, any type of balance problems, any type of sensitivity to light or noise. They may have trouble with concentration. They have trouble with their memory, feeling slowed down. They might be irritable, more emotional, and some of the later problems with concussion is they may have trouble falling asleep or feel drowsy. Now, what we do know about concussions is that it is an evolving injury. So sometimes within a few minutes, you may only have a few symptoms, and over the course of 24 to 48 hours, their symptoms may worsen. Now, what we want to do when someone has a head injury like this and are exhibiting signs and symptoms of concussion, we definitely want to pull them out of any type of further football activity, let them rest on the sideline. Now, but if any of their symptoms seem to be worsening dramatically in the first 1 to 2 hours, they probably should go to the emergency room to be evaluated for other injuries to the head that may require something more than just simple concussion treatment. Now, most concussions do not require hospitalization. They do require evaluation with a properly trained concussion specialist. But the most important thing is to remove the player from the activity. Within the next 24 hours, they need to seek medical care for evaluation. They need to be held out of activity until their symptoms resolve. Once their symptoms resolve completely, they need to begin a 5-stage return to play protocol, which is a gradual advancement of their activities. And this will all be coordinated by your healthcare provider. So this is all I have today. So I wish you and your sons the best of luck in the upcoming football season. Thank you.
All right, campers, drill number 5 is our defensive line attack drill. During this drill, our goal is to teach proper defensive line stance, to teach how to bear crawl and how to rip. Okay, in the defensive line attack drill, there are 3 things we're going to focus on: a proper stance, bear crawl, and a rip. First, what I'd like all of our campers to do is put your feet apart in a nice wide stance. Keep your head up and rest all of your weight on your elbows, onto your legs, on your knees, right here. Now, keeping your head up, just gently reach down and put your hand down on the ground, and now you're in a proper stance. Go ahead and stand back up. Okay, now, the second technique is proper bear crawl, so we're gonna have our campers demonstrate that. Let's get into our stance. Go down a stance, Miles, and go. Excellent. Next. Ready, go. Low. Good job. Next. Ready, go. Great job. Ready, go. Nice and low. Keeping your pads down. Our final technique of the defensive line attack drill is to learn how to rip our inside shoulder. Our campers are going to demonstrate that right now. Ready, Miles? Go. Rip it. Touch the ground. Great job. Ready, go. Rip the arm, rip the shoulder through, touch the ground. Great job. Way to turn the corner. Ready, go. Touch the ground, lower that shoulder. Great job. Okay, phase 2 of our defensive line attack drill is our 30-second challenge. In the 30-second challenge, you will start off with a bear crawl to the first cone. You'll rip the inside shoulder through on the second cone, and then you will get to the 4th cone. When you get to the final cone, Miles, when you get over there, you'll turn around and do the whole thing backwards. Bear crawl, rip the shoulder, and come back. So you do the opposite thing on the way back. Every time you touch one of the front cones, that counts as 1. Your goal is to see, correct, 30 seconds, and your goal is to see how many you can do in 30 seconds. Are you ready, Miles? Bear crawl first. Ready, go. Rip the inside shoulder. Good, come here. Bear crawl, back, bear crawl. Rip the left hand now, rip the left hand. Great, come through. Excellent job, Miles. Okay, campers, our final stage of the defensive line attack drill is our advanced variation. In the advanced variation, we're going to start off with the same bear crawl and rip the arm through, but on the final stage, you will scoop and pick up a fumble and give it back to coach. The front cones still count as 1 each, and you're going for your best score in 30 seconds. Are you ready? Down in a stance, please. Ready, go. Bear crawl. Run, rip the inside. Good, scoop. Give it back to coach. Bear crawl. Bear crawl, bear crawl. Rip the left hand this time, left hand. Scoop. Give it back to coach. Great job. Okay, campers, drill number 6 is our running back agility. In this drill, our objective is to teach you how to securely hold the football and also to improve your agility and balance in running the ball. Okay, campers, the first thing we want to do before we start the running back agility is learn how to securely hold the football. What I'd like all the campers to do is hold it out in your right hand. Take your 2 fingers, like a peace sign, and split them apart. I'd like you to put those right on the tip of the ball and then wrap your hand around the ball like coach has and tuck it right inside your forearm and bicep and secure it tightly. Coach is going to come by and check to see if you have a proper grip. Okay, those are all tucked away nicely, and now we have securely learned how to hold the football. Okay, campers, phase 2 of our running back agility is our 30-second challenge. In this drill, campers will run to the first cone, put their hand down on the inside in return, where they will switch by putting the football into their other hand at this cone and complete the same drill on the far end. This is a drill that works on balance and agility. Let's see a demonstration. Ready, go. Hand down, run, good. We're gonna switch right at this cone, ball in the left hand, inside hand down, short steps, and return to the middle. Excellent job. Okay, campers, and our final stage of the running back agility is going to be our advanced variation. In this drill, you're going to need to lay something down on the field in between your cones. In this case, we have a towel. It's going to be the same drill, but the added variation is we're going to be hopping left and right over the towel and completing the same hand down, fast footwork. Are you ready to demonstrate? Ready, go. Hop twice. 1, 2, left hand down. Return, hop twice. Good. Switch at the middle, hop twice. Right hand down, and return, 2 hops. Excellent job. Try to get your best score in 30 seconds. Okay, campers, drill 7 is our receiver route and catch drill. During this drill, you're gonna learn a proper receiver stance. You're gonna learn how to catch a ball that is low, how to catch a ball that is high, and how to break down on a route. Okay, the first segment of our receiver route and catch drill is to learn how to stand in a proper receiver stance. I would like my campers to demonstrate by getting in a good position, Russell, feet apart, knees bent, hands together, ready to burst off the line of scrimmage. When I say go, let me see your takeoff. Ready, go. Ready, go. Ready, go. Okay, campers, the second segment of our receiver route and catch drill is to learn the difference between catching a ball that is thrown low versus a ball that's thrown high. In this first demonstration, our campers are going to show how to catch a ball that's low. And what we want to do is put our pinkies together on any ball that's thrown to you low. Pinkies together on a low throw. Excellent job. Use your eyes, look it in. Great job. Pinkies together. Now, if a ball is thrown to you high, we're going to switch that and we're going to go thumbs together. So campers will demonstrate thumbs together right now. Go ahead and show them. Put your hands up before coach even throws it. Look the ball in. Use your eyes to look it in. And excellent job. All right, campers, the next part of our receiver route and catch drill is our 30-second challenge. In the 30-second challenge, you're going to get in a great stance. You're going to run forward to the first cone. You're going to chop your feet and break down on the route and turn to the right and catch a pass from coach. Okay, finish all the way around the square and then give the ball back and repeat the same thing in the opposite direction. Every time you make a pass, you count it as 1 and you're going for your best score in 30 seconds. Nate, we're going to go ahead and demonstrate this now. Ready, go. Coach, you got him from here. All the way around. Get in a stance. Break down, pick it up, keep going. Great job. Okay, campers, the last phase of our receiver route and catch drill is our advanced variation. In the advanced variation, you'll do exactly like you did in our first drill. The only difference is the ball coming to you will be either low or high. If it's low, catch with pinkies together. If it's high, catch with thumbs together. We're going to demonstrate this right now. Let's get in a great stance. Coach, you got him. Good job. Keep going, keep going, keep going. Get in a stance. It's gonna be high, it's gonna be high. Great job, keep going, finish through. Excellent job. Okay, campers, in drill number 8, we are gonna be having our quarterback challenge. In the quarterback challenge, our objective is to teach the proper way to hold a football and how to develop accuracy in your throwing motion. Okay, campers, the first segment of our quarterback challenge is to learn how to properly hold a football. What we'd like all the campers to do right now is to take your middle finger and set it on the very top of the laces. What that's going to do is have your index finger and your thumb off the laces, and your ring finger and your pinky will actually be on the laces. So that middle finger sets the guide for how we hold the football. Okay, campers, the second segment of our quarterback challenge is to learn a basic delivery of a football in your throwing motion. What we're going to ask all the campers to do is this. We're going to ask you to demonstrate a throw that is up and over your shoulder and finishes with a point to the target. Coach, go ahead and please receive these passes. Go ahead and demonstrate. Good job, nice spiral. Up and over the shoulder, finish by pointing at the target. Very good. Great job. And throw and point to the target. Great job, campers. Okay, campers, and our final segment of the quarterback challenge is target practice. What you're going to do in this drill is you're going to turn sideways, make sure you have a proper grip, and your goal is to try to hit the target. In this case, it's a hula hoop. It could be the circles of somebody who is out there with you. It could be a pillow. It could be basically anything. You can hold up a towel, but you have to have some target that you're going to hit. And your goal in the quarterback challenge is to see how many times you can hit the target in a row. Keep doing this drill until you improve your accuracy, and remember, follow through and point to the target. Let's have our campers demonstrate right now. First camper, ready, go. Great job. Second camper, go. Good job. Next camper, go. Good job. It's all right. Next camper, go. Great job. And last one, ready, go. Excellent job. See how many times you can hit the target in a row for your best score.
Thank you for tuning in today at the 2020 Cleveland Browns Virtual Youth Football Clinic in association with University Hospitals.
1, 2, 3, Browns!
And make sure you follow us on Twitter at BrownsYouthFB for all information on Cleveland Browns youth and high school football. Thank you, enjoy.
What's up? It's Jacob Phillips.
It's Nick Harris.
It's Ben LeMay, running back for the Cleveland Browns.
Solomon Ajayi.
Brian Ham. My name is Nate Weeding.
Harrison Bryant, tight end for your Cleveland Browns. Thank you for joining us today at the Virtual Youth Football Clinic.
And I really wish I was there, having fun with y'all.
But we hope you enjoyed the day. We hope to see you real soon at First Energy Stadium.
Enjoy the rest of your summer, stay safe, and stay in the game.
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 And stay in the game.
Stay in the game. See y'all.